Hi guys, this is Cristian from ArtSmiles and I'd like to answer the question, do I have to get veneers in all my front teeth? So the answer depends. Let's go into it, and I'm going to show you some cases, how I solved some cases, and then you can understand better what's behind the decision of doing multiple veneers or just doing a more conservative approach. Let's go into it. So this is the first case. This young lady, she was a lovely lady, super anxious with her smile and with the results, and she wanted, of course, to improve the smile, especially the central incisor. This tooth here had broken a few months ago, and she went to another dentist and to do the treatment, and the result was unsatisfactory for her. She wasn't happy with that, and she came to me to fix to give a definite solution. So we did a ceramic crown in this tooth, and two composite fillings in this tooth here and this tooth here. Okay, so we are using different materials here. For very minor repairs, we can use composite. It's a very good material for this specific case, but I wouldn't recommend composite for a replacement of the entire face of a tooth. Okay, so in this case, it was cosmetically, technically not difficult for me. I have some years of experience in this area, but technically for the lab it was quite difficult. They had to do this case 3 times to match the color. So when we are working with a very high-end dentistry, sometimes you need to be just patient. You know, you need some patience you need to trust that the dentist is doing their best, and sometimes if it's not perfect, it's because it's not finished yet. Okay, so as I said, this case we had to do 3 times. Sometimes when we and this is quite a routine. Sometimes when we do just one tooth, this is, cosmetically speaking, it's very challenging for the lab to match the color, and sometimes we need to, you know, center the lab again to do the treatment again. So just be patient, and everything in the end, everything is going to be good. All right. This is one case. Just we worked in we work in 3 teeth, and mainly with one is the central incisor that we did the crown. Ceramic crown. This is a more comprehensive case. In this case here, this patient had multiple composite veneers, direct composite veneers, with multiple problems with the shape, with the shade, breaking, chipping in the veneers, and this work has been done just 2 years ago, and then he came to my office asking for a replacement. This is what happens. I say this quite frequently with this kind of material. Composite veneers, if you ask me, every now and then I refuse doing the treatments with full mouth, more comprehensive treatments with composite, because this material usually tends to break and chip over the years. And the patients, they get happy in the beginning because it's beautiful, but after some time the problems come, you know, and it's a nightmare for the patient and for the dentist. That's why I don't do this sort of treatment anymore. I've done this in the past, but I learned from my mistakes, from my errors, and I don't do this anymore. And that's why if you come to me, I usually I'm going to offer ceramic veneers, because this material is stable, this material is going to last, doesn't stain, and it's a much better outcome cosmetically in the beginning and in the long term as well. Okay, so for this gentleman, we did it was a full mouth. We did all teeth in ceramic, and he was pretty happy with that. This is another case. The main complaint of the patient was this tooth here. The central incisor was a bit darker, and she was complaining just about that one. And I said, look, to have a better outcome, I think would be better if we start with a whitening, we change some fillings, and then we do the veneers. And that's what we did, and this is the result, as you can see. So sometimes it's just one tooth, and I offer, well, as I have a broader view, I think that doing just some fine tunes, just some adjustments, we could have a much better outcome. And this is what we've got here with this result. This is another case. A young man, he asked me to replace. He'd like to fix this 4 teeth here. Okay. And he didn't want to work in the back. He was happy with the shade. When I showed him the color of the canines, this tooth here, and this one here, they were quite dark. And I said, as we are doing 4 teeth already to change the shape and make a better smile, why not doing veneers in the canines as well? And then we can bring the shade for a much whiter shade and much more pleasant smile. And that's what we did. And we worked in 6 teeth, as you can see here. There's 6 teeth, and we got I believe a very good result. He was very happy with this solution for this case. So this is how we work. This is how I do dentistry. I do cosmetic dentistry. I usually I try to talk to the patient. Sometimes I refuse treatment if the treatment is not adequate. If it's not if I believe it's not the best for the patient. Just to give you an idea, a few months ago I had a patient with all teeth in the mouth. She'd like to have all on 4. All on 4 is a resource we place 4 implants and a bridge on implants, and I think it wasn't the best treatment for the patient, and I refuse to do this. Sometimes I do this in cosmetic dentistry as well, especially when the patient wants something that is not good for them. And I just try to be honest in all my cases, and I try to do my best to deliver the best outcome, something that is going to be beautiful, but with a very good function and with a very reliable longevity. This is what I want to deliver. I want to see my patients after the treatment just for regular maintenance. I don't want to redo treatments. You know, this is I don't want to cause any problems for our patients. So this is how I do dentistry. This is how I believe that it should be done. Okay, thank you for watching. If you need anything, I'm here in Southport and I'm happy to help. Thank you.